Polyurethane or PU or PUR is not just used in shoe soles, but also as a build-up material or cushioning material in orthopedic applications, both in prosthetics or braces as a cushioning material and in insoles either as a cushion or for certain areas that require a very, very soft bedding or even as a top cover. The same rules apply. Polyurethane is a foam, or foamed expanded polyurethane is used here. So open cell foam and a skin around the outside. Most materials you can buy already have that skin removed or abraded on one side, in some cases on both sides. So it is a lot easier to bond because it's also usually fresh material, not worn material. You'd usually take this out of the box, and that also makes identification easy because it says PU on the box. There's several brand names that people usually look at when they're dealing with this. Sometimes it's called PPT, sometimes it's called Poron, sometimes it's called polyurethane sheets, PU sheets, PU foam. It's simply a matter of which one you're using, and they all handle pretty much the same. Of course, there's differences in the application, in density, in hardness, in how they wear, but as far as bonding is concerned, we can all treat them in the same way. There's certain things you need to be aware of when bonding this material. The first one is be wary of potential contamination with separating or mold release agents. Polyurethane expands into a mold or onto something, and in order to get it out of that mold, very often mold release is used, which can then still be on the surface unless it is taken off, unless it's cleaned off. If it's not cleaned off, if it remains on the surface, or if anything else, like oil on a blade used for splitting, gets onto either side of this material, it's often sold rolled up. So, of course, what is on one side will transfer to the other, and you might get separator mold release in the most unexpected places. This is, of course, something that makes surfaces non-sticky, and that, of course, counteracts the effects of the adhesive. So before you bond, if there's mold release involved, that needs to come off. Which leads us to the second problem. This material reacts to solvent by crumpling up, curdling up. So if you try to clean this with acetone, with thinner, in many cases you actually start dissolving the material. So that's not necessarily the best option. You can use a soap-based cleaner, water-based cleaner. Then you need to make sure that the material doesn't absorb too much water. So it can be a little tricky to handle. The bonding itself is very simple. It's an open cell foam, open cell material. Make sure you have enough adhesive on the surface. Any Renia adhesive will work here, although because of such an absorbent surface, I would prefer higher concentrated adhesives like our Topfit, like our Ortec, that are geared more towards bonding foams, but Col de Cologne, Certainty Total, Superfix, anything like this will work, no problem at all. Sometimes this is used in between layers in a sandwich construction, sometimes it's used on top of things. One word of caution, if you're using this as a top cover, of course you will get a very, very soft bedding effect, but keep in mind polyurethane, even if we are talking about a closed surface like this one here, polyurethane foam is water absorbent, absorbs fluids, and that includes fluids seeping out of wounds, seeping out of cuts, and if it gets into the foam, once you have a little bit of a cut of a rip in the integral skin on the outside, it will penetrate the foam will soak it up, and then it's very, very difficult to get out there and to keep it clean. One advantage of EVA that it doesn't have that effect. Polyurethane foam still serves its purpose with that soft cushioning and good return, but maybe better used on the inside of a construction and not necessarily on top.